15 seconds it takes us to get the live stream started. But what an amazing thing to be able to broadcast all over the world right now. And we are live, Doug. What's that?
Hey.
Go ahead, Doug. Sorry.
Okay. Thank you, Jason. Way to make me feel comfortable right as we're starting there to tell me that we're broadcasting live to the world.
To the world.
I appreciate everybody joining us this morning for this safety moment. I'm going to take a little bit of time today to talk a little bit more about COVID-19. And, when I first thought about this, I thought, we got to all be COVID out by now. But, one of the reasons we are a little tired of this is because it's going on, because it's having a significant impact on our lives, our personal lives, as well as our professional lives and what we do. And, I would really like this to be over. I'd really like to go back to, being able to, give handshakes and do live trainings without concerns. And I really love to see the economy be able to get back on track and see people at work and not worried about this. And I really kind of think that's one of the biggest things. A lot of us, when we get really, concerned about this, we look at the economy. And, we don't want the economy shut down for, whatever your perspective is. And I know that this has become kind of a politically charged topic, and it means different things to different people. But today we want to talk a little bit about, some of the science that has come out, some of the results of studies that we have seen over the last few months. It's interesting when we went to our lockdown, our stay in place, back in March, there was a lot we didn't know, and there's still a lot we don't know, but we've been, striving to understand this situation a little bit better. And I think, I don't think I'm going to tell you anything today that's new to you, and not drastically new. Maybe we'll think about things in a little different light. But if anything, I hope we just can all walk away with a better understanding of how together we can bring an end to this situation, keep our economy on course and progressing, and hopefully not go backwards. That's my biggest fear. A couple of weeks ago, when the governor was doing one of his press conferences, he said, if we can't get the average daily new case rate under 500, we may have to go back to greater restrictions, and go back to orange status. And so none of us want that, regardless of how you view this whole COVID-19 pandemic and whatever your perspective is on it. We don't want to go backwards on this. And so let's just talk a little bit about, what do we understand about COVID-19 at this point? First of all, COVID-19 is the disease. It's not the virus. The virus that causes COVID-19 is the severe acute respiratory syndrome coronavirus 2. And, that's kind of a long word, and it's got a number in there. Well, these SARS viruses are continually, like all viruses, are mutating and changing. And one thing that really worries me is that, when we get this one under control, when's the next one? Next year, 10 years down the road, are we going to see another coronavirus come up that's particularly, fatal, particularly contagious? Maybe worse than this one. And, there's been a lot of argument about whether this virus, if this coronavirus merits the reaction that it has had. But it really isn't, especially now at this point with the perspective that we have. I don't think it's hard to imagine, a similar situation with a worse virus. And to me, that's really kind of scary. If we had one that really had a high fatality rate, would we be able to control it? Would we be able to convince people soon enough, to take some of the simple measures to protect themselves and to prevent the spread? And that's really what we want to talk about. A lot of people have talked about this particular COVID-19 as being a dry run for maybe a really bad pandemic. Not that this one hasn't been bad. I don't want to minimize the fact that I think we're around 800,000 lives lost to COVID-19 worldwide, and over 150,000 in the United States now. This is an extremely contagious virus. It passes from person to person very easily. and it does have a mortality rate associated with it. And there've been a lot of arguments out there saying it's no worse than the common flu, but that's not really true. The common flu has a mortality rate of about 0.1%. This COVID, the SARS-CoV-2 virus, is about a 0.3 up to maybe 5.5%, mortality rate, depending on the population and the area that we're in, depending on the healthcare that's available in different regions. Right now in Utah, if you look at the numbers, our deaths to total cases, we're at about 7 or 0.8%. So a little shy of 1% mortality rate on those who have the virus. So that's at least 7 or 8 times greater mortality rate than the common flu. And that's just here in Utah. Nationwide, the mortality rate so far on this outbreak is about 3.3%. Nationwide, and worldwide it's about 3.7% right now. And so if you look at those numbers, it's greatly much more serious than just the common flu. And again, I know I've heard a lot of people arguing about how valid those numbers are, and even if only half those numbers are actual coronavirus fatalities, it's still way worse than the common flu as far as the mortality rate and how contagious it is as well. Another thing, it's not just a matter of getting sick and then getting over it and having antibodies and there I'm better, I'm immune, because this virus has shown that it can cause severe damage to your respiratory and your cardiovascular system. It can cause damage to your lungs, liver, and heart. Perhaps lasting, perhaps permanent. We have to see how this will play out. It can result in a permanent loss of your taste. It could result in blood clots or stroke, that could be, life-ending or debilitating. And so, this is a serious thing. I don't think anybody should go out there and want to try and contract this on purpose, because it could have some pretty serious, effects on you long-term, even if you're healthy and strong. We know that we need to protect high-risk individuals, and part of our plan needs to involve that. Regardless of how we get to herd immunity, we need to protect the vulnerable in our population. So the elderly, those that are over 60, need to be extra careful. The older you are, the higher the mortality rate. If you get up into the 80s, the mortality rate approaches 50%. So that's extremely high, for the elderly who contract this virus and get this disease. Underlying conditions can also increase your risk of mortality. So if you already have some sort of lung, kidney, liver, or heart disease, the coronavirus will cause damage to those organs. So if those organs are already weak, and you contract this virus, that's going to give your risk or your chance of surviving, going to be a lot lower. Respiratory conditions like asthma, obviously SARS is a respiratory virus. And so if you've got any kind of conditions, with your respiratory system like asthma, that's going to increase your risk. Diabetes, high blood pressure, cancer, some things that could even be genetic, that could be, affect some races more than others come into play. Sickle cell disease will affect someone's immune system and therefore make that person more susceptible to death from this virus as well. So anything that compromises the immune system, whether it's health conditions or medication that's being taken, that's going to possibly put someone in a higher risk. And something interesting I found as I was reading up on this was that people who are in areas with high air pollution, people who are subjected to poor air quality frequently on long-term basis, are also more susceptible to have a severe reaction to COVID-19 or possibly even death. So lots of things can come into play here. How is it transmitted? If we're going to control this, it's really important to understand how it's transmitted. I'm sure you've all heard the term, respiratory droplets, and that's how the virus travels. It's will leave your body on these respiratory droplets, whether they're vapor, size or larger droplets. That's how that virus travels out of you. And another person can be infected directly or indirectly. When someone exhales or coughs or sneezes or speaks and spews, droplets into the air that have the virus on them, someone else could inhale that virus directly from the air, especially if they're in close proximity to someone who, isn't talking through a mask, for example. And so that puts that person at greater risk. Now, the virus is not airborne. It doesn't just kind of, stay up there in the air. It will fall out within minutes to hours, depending on the conditions. But we still need to take that into consideration. It is possible to directly inhale the virus from someone who has exhaled that virus if we're there in a reasonable time period and close to where they were. But we can also be looking at indirect contact where, our hand comes into contact with a surface that's contaminated. And then, we touch our eyes, our nose, our mouth, and then we become infected as well. And so, or even through contact with a device, a door handle, a cell phone that's gone from someone's hand to another person's hand, or anything like that we're handing from person to person. When I go in to get my Egg McMuffin in the morning at McDonald's and I hand the guy my credit card, I have some hand sanitizer in the car there. And I usually get a little squirt on my hands and I sanitize my hands and I actually rub it onto my credit card too before I hand it to him. And when he hands it back to me, I do the same thing before I put it back in my wallet, because I want to, that just passed from someone's hand, gloved or not, you don't know if it's contaminated, that's a potential, contact. And so we need to minimize and manage that risk. And of course, my example is kind of a poor one because I'm knowingly engaging in a transaction that's going to require passing something. I should be paying with an app or something so that I don't have to have contact. So, when we exhale these droplets into the air, they will fall out onto a surface. And once they're on that surface, that virus may still be contagious for hours or even days. It really depends on the conditions, the humidity, the temperature, exposure to sunlight. It can depend on the type of material that droplet lands on, whether it's a natural fiber, whether it's steel or glass or wood. It will survive different lengths of time. In some conditions, on some types of material, this virus is known to be viable still up to a week after it contaminated a surface. Generally, within a day, it's not going to be a viable virus anymore, but even up to 3 days in general. So we need to be careful with contact with those high touch surfaces. Make sure that we're disinfecting those surfaces and be careful about your contact with high touch surfaces. So we mentioned this respiratory droplets. It can float in the air for minutes to hours, depending on the conditions, but it will generally fall out and then it will be on a surface. We need to make sure that we understand also if we're potentially exposed, this incubation period is up to 2 weeks, up to 15 days. As a general rule, though, people will, if they're going to be symptomatic, those symptoms will show on average between 3 and 5 days, but it can be up to 15 days. The virus is most contagious the day before your symptoms exhibit. And so for 24 hours before you're feeling sick or having any symptoms at all, you're already spreading the virus around, at its maximum contagion level. And so from that first day before till, a couple, 2 or 3 days after you become symptomatic, you are highly contagious. And so we also need to think about controlling the spread if we may be contagious. How do we get this whole program, this whole situation under control? How do we end the Corona-19 madness? Well, we've got to get to a point where we have herd immunity. Ultimately, we have to get to a point where enough people in society have been exposed and have developed antibodies that they work basically as a buffer, as a filter to prevent this virus from spreading from person to person. And so ideally, that's what we want. We want herd immunity. That can happen naturally just by passing the virus along to each other, or that can happen with a vaccine. and hopefully we have a vaccine before too long, and we can hopefully, inoculate the higher risk individuals first to protect them. That's really that responsibility we have to protect the more vulnerable, that are around us. So if we want to prevent, though, the spread, so that the spread doesn't get out of control, because remember, the governor talking about, if these numbers stay high, we may have to go backwards, on our restrictions and shutting businesses down again, perhaps. And so we don't want that to happen. None of us want that to happen, so we need to control it. And how are we going to do that? Prevention can happen in different ways. Number one, don't catch it. If you don't catch it, you're not going to pass it along. But we also want to make sure that, if we do have it or others, that we can contain it and not have it spread from person to person. The way it gets into your body and infects you is through the eyes, nose, or mouth. Okay, touching it with, having it on your hands, having your hands infected is not going to get you sick. But when you take that infected hand and you rub your eye, or, pick your teeth or whatever, that is where, you get infected. Or if you do inhale directly, something that's floating in the air. And so we need to protect our eyes, nose, and mouth. We need to wash our hands or sanitize our hands frequently. When you wash your hands, make sure you lather for 20 seconds. The longer you lather, the more virus and bacteria on your hands you're going to kill. And so don't just do a little quick rinse under the water and call it good. Get that soap on there and lather it good for 20 seconds, and or sanitize your hands with hand sanitizer, which works great, but to a point. If you don't wash your hands, you don't remove the soil from your hands. Hand sanitizer doesn't clean your hands, it disinfects your hands. And so you still want to wash your hands. And then we also want to disinfect those common touch surfaces where the virus may be sitting, waiting to get picked up on somebody's hand and moved to the face, the eyes, nose, or mouth. And finally, also there's the distancing. When we exhale, when we speak, and we spew out respiratory droplets, those generally aren't going to travel more than a few feet away from us. So if we can maintain that, 6-foot space, that will pretty much keep us away from that direct inhaling something that somebody may be exhaling. Is it a guarantee that, 100% of the time it's going to be enough? No, it's not, but it's going to, protect you from the vast majority of that exposure if you just maintain sufficient distance. A lot of people argue about whether masks are useful or whether they're really helping or not. A lot of arguments out there, a lot of people who are against, wearing masks for various reasons. And for some people, it's become a political issue. And I really hope we don't make a political issue out of this. The question is it helpful in preventing the spread of the coronavirus? And if it is helpful in preventing the spread of the coronavirus and keeping, the growth of cases down to a manageable level where we don't have to shut down the economy again, then we should use them. It's something that's not that difficult to do. And, if we do it right, it can have significant impact. An article came out a week or so ago, and it was written by some professors, scientists at Brigham Young University. And they went to about 98 different sources of peer-reviewed studies, field experience, different things that have been going on over, the recent months. And they compiled the data on, are masks effective and are they safe? And the simple answer is yes. They're safe, they're effective. And it's a simple, cost-effective way to try and control the virus. In fact, some studies have said that this is probably the most powerful, most cost-effective way, to keep the virus in check. Some of the experiments that have done have resulted in measuring how much virus can pass through one of these masks. And when they used a common influenza virus, a common flu virus, the mask would catch about 90% of that virus. But in these same studies, they found that the coronavirus was captured by the mask at an even higher rate than the normal flu. And so, wearing a mask for specifically containing and controlling coronavirus may be even more effective than for influenza. If you want to 100% protect yourself from breathing something in, you need to have a tight, full fitting respirator. Okay, that's the only way to really make sure that you're protected from anything you're breathing in. And N95 isn't going to be 100%. That's why the number is 95, not 100. And so there's always a risk you're going to breathe something in. If you've got a cloth face covering, obviously multiple layers. If your face mask is made of 2 or 3 layers, it's going to be more effective than a single layer. And so, if we want it to be effective, we do need to cover our face, but there's no guarantee. Masks are intended to be a source control. They're not necessarily PPE. Do they lower the risk that you're going to inhale some virus and get infected? Yes, they do. I think they do provide some protection. But where they really provide protection is to society as a whole. If we have enough people wearing the masks, it catches the virus. It catches those respiratory droplets in the mask. And you'll notice how effective the mask is in catching the respiratory droplets. Because if you're speaking a lot through the mask, you'll notice it starts to get a little damp on the inside of the mask. And that's because it does catch that, moisture and condensation that's coming out of your mouth or from your exhale. And so, it catches that. And that's really how we need to think about the mask. It's source control. It's not necessarily personal protective equipment. In countries where masking is more of a social norm, like Korea, Hong Kong, and places like this, they found that the initial growth rate of the virus, or the spread of the virus, was about 56% lower in those places where people commonly will use masks anyway, versus places like the United States, where we're not accustomed to, just wearing masks around all the time. And so that, is some pretty significant evidence that it is effective. Another thing that we could think about, some studies recently suggest that viral loading, or how much of the virus you're actually exposed to, is a significant factor in how sick someone may become. That if you get a much bigger dose of the virus when you are infected, you have a higher risk of becoming more ill than you otherwise would. And of course, the mask helps reduce that viral loading. Number one, it's catching virus in the mask when people are exhaling if they're infected. If you're breathing through the mask, it's filtering most of that out so that you're not going to get exposed to as much if it does get into you. There was 2 peer-reviewed studies that were done where the masks were shown to reduce the rate of infection by 75 to 82% in populations that had near universal use of masks. And so that is significant. That's pretty good evidence that if you wear a mask, you're not going to be spreading it around to others. That infection rate is going to stay lower. And some studies have actually said that if we can get 80% of the population to wear masks when they're around others and out in public, that that would be more effective at controlling the coronavirus than a total shutdown of the economy. And so, what's easier to deal with? Stay in place orders or quarantines and shutting down the economy and businesses, or putting a mask over your nose and mouth. I think, wearing the mask is a lot easier, a lot less painful. I may not like it, but it's a lot better than the alternative. And if we can get 80% of us, they say, to do that for a few weeks, and it would have to be universal. I mean, not just one neighborhood or one town. We could get this thing under control.
Hey, Doug, quick question.
Yeah.
We had a question that have there been any studies on the effectiveness of clear face shields?
I did not see any studies on clear face shields. Obviously, a clear face shield is not going to be a respirator. It's not going to filter anything out. It will protect you from direct contact. If someone sneezes in your face, if someone's talking and spewing, respiratory droplets in your direction, it's going to hit that shield and be deflected, right? But, will some of it waft up underneath and you can still inhale it? Absolutely, yes. But no, I didn't find any studies that talked about the effectiveness of face shields. They do have an effect. They obviously are a level of protection, but it's not as high a level of protection just by logic as a filtering material would be, which that face shield is not a filtering material, unless you're using, something in conjunction with the face shield. The face shield could keep things from coming in direct contact with your eyes, for example, and then you could still be wearing a mask over your nose and mouth, to keep you from inhaling the virus. So it does provide some protection and even additional protection, especially for the eyes. So I think we need to look at spread versus contraction. What the goal here is more about preventing the spread among a population rather than it is, so much about whether I catch it myself. I don't want to catch it myself. And if I don't catch it, I'm not going to spread it. So, not catching the virus is preventing spreading the virus, but we need to all work together to prevent the spread of the virus. My mask protects you. When we're talking about source control, if I'm wearing a mask, that keeps me from infecting you. And if you're wearing your mask, that keeps you from infecting me. That's really how we need to think about it, is that we're doing this for others. We're not doing it for ourselves. And also, if you're sick, stay home. Whether or not you think you've got coronavirus, COVID-19 or not, if you're sick, stay home. If you're sick, if you have a fever, you're probably contagious. Whatever you have is probably contagious if you have a fever, especially. So, make sure that you respect others, by staying home. Here's just a graphic representation. These are pictures of respiratory droplets that are being ejected from someone's mouth while they're speaking, just normal, talking. And the without mask, these droplets are illuminating these droplets with laser beams. So you can see, these droplets as they come out of the person's mouth. And so you can obviously see in these two pictures that with the mask, it's not 100%. There are still some droplets that escape out either through the mask or around the sides of the mask. But it's significantly less than if it's just unprotected and being spewed out there. And that's where surfaces get contaminated, or possibly, air, stuff floating around in the air still that you may breathe in. We prevent from catching it by distancing ourselves, by washing our hands and sanitizing our hands, and by, being careful about, contact with our face, that hand to face, movement. If you do have to touch your face, wash your hands first, or use some hand sanitizer first. But that's when, that is going to often happen, that indirect, contraction of the virus is, putting your hand to your mouth, to your nose, to your eye. So wash your hands, don't touch your face, and wash your mask. If it's doing its job and it has been catching some virus, you want to make sure that you clean that out regularly with soap and water, so that, you can remove that virus that may be riding along on your mask. And be really careful about touching your mask too. If you touch the outside of your mask and then, reach up there and also scratch your nose, you're putting yourself at risk. So in summary, what we really want is fewer and fewer cases. If we want our economy to stay open and to continue opening, we've got to keep the case counts, moving down and not increasing. And the way we do that, number one, we protect ourselves. If we don't get it, we're not going to spread it. So wash your hands, don't touch your face, use distancing, but also protect others by wearing that mask. And you need to wear it properly. It needs to cover your mouth and your nose. Respiratory droplets do come out of the nostrils, not probably as high a rate as they do come out of your mouth, especially when you're talking or coughing or sneezing. That's going to be a lot more, but you need to cover both the mouth and nose, and disinfect those common touch surfaces. It may be even a good courtesy to disinfect a surface that you touch when you're in an area that others are also going to be using. But at least have a practice or a procedures and protocol in place in the areas that you have control over for daily or even more frequent sanitizing of those high touch surfaces, handrails, doorknobs, tabletops, and light switches and so forth, so that we can control, this virus getting out there and potentially spreading to others. Again, I just want to emphasize, what we really need to be focused on is controlling the case counts and getting those down so that we can keep people at work and get people back to work. It's the simplest way that we individually can contribute to controlling the madness, to ending this madness. Any questions out there? Any other questions?
Folks, if you got any questions, type those into the chat box and we'll get those to Doug right now. Interesting times we live in. Who would have thought in January that this is where we would be at this point? But we're here.
We were hoping it would just be a couple of months, right? Hey, it's a month, maybe 2 months, we can get this thing under control. But because, as a large rule, the majority of the population, wasn't and hasn't been, taking those precautions to help, keep this under control.
All right. Just looking at the chat box and it's quiet.
Okay. Well, thanks everybody for tuning in. Spread the news, share this, encourage others, especially your staff. We want to keep our staff healthy and working strong, and it's really important, even if you're in an area where, COVID-19 hasn't really had much of a foothold yet. If we, all together, in high infection areas as well as low infection areas, if we all take the precautions together for a relatively short period of time, we should be able to get it down to a level, that is controllable, and maybe even be able to bring it to an end. And especially, with potential vaccines on the horizon, I think, we have that goal, I think, to keep everything under control until that, hopefully that solution is available to us. So get out there, stay safe, have a great day.